Madam Rafi. Today we are going to discuss about alcohols and types and their treatments. So first we'll see what is alcohol. Alcohol is a CNS depressant drug. Okay. It will form two types of dependence. That is, one is psychological dependence, at the same time physical dependence, and it will follow zero order kinetics. That means fixed volume will get excreted based irrespective of volume. Okay. So there are three types of alcohol will be there. That is ethyl alcohol, also known as ethanol, methyl alcohol, also known as methanol, and ethylene glycol. Among these three, ethanol and methanol are very important for MCQ purpose. Ethylene glycol, it will cause when your consumption ethylene glycol, it will have chance to for renal caliculi, mostly oxalate stones. Okay. So we'll discuss each one in separate. Ethylene, first ethanol, that is ethyl alcohol. Acute ingestion of large quantities will cause hypotension. Chronic ingestion of large quantities will cause dilated cardiomyopathy. Okay. So when you are taking alcohol large quantities in a short period, it will have a chance to develop hypotension. That the same large quantities when for a prolonged period and more than 1 year, 10, 2 years, patient has chance to develop dilated cardiomyopathy. So it will have one more therapeutic purpose also, that is moderate quantity, that is 50 to 100 ml daily consumption will have chance of reducing coronary artery disease by increasing HDL levels when decreasing LDL levels. So here the main important MCQs will be drug of choice for alcohol withdrawal. Okay, what is alcohol withdrawal? If a alcohol dependent patient, whether it may be psychological or physical dependence patient, if he is not consumption alcohol within 24 hours, patient will have symptoms like delirium, tremors will be there, hallucinations, all these symptoms will be there. So this is known as alcohol withdrawal. So how do you control all those things? By giving diazepam and chlordiazepoxide. And one more MCQ here, main focus is drugs decreasing alcohol craving. Means that irresistance will be there. They have to crave for alcohol consumption. Those drugs will be naltrexone, ondansetron, topiramate, acamprostate. Among these four, naltrexone is most common MCQ. Okay. If there are four options will be there, we'll go with naltrexone. Naltrexone is the drug of choice. Alcohol craving will be controlled by naltrexone. If there is another options also there, ondansetron, topiramate, acamprostate, these drugs also we can use, but mainly naltrexone. Okay. Next, we'll discuss disulfiram reaction. So before discussing disulfiram reaction, we'll discuss about metabolism of alcohol. When a person is consumed ethyl alcohol or ethanol, it is converted into acetaldehyde with the help of alcohol dehydrogenase enzyme. Okay. So this acetaldehyde is an intermediate metabolite which is further converted into acetate with the help of aldehyde dehydrogenase enzyme. So now we'll discuss disulfiram reaction. What is disulfiram reaction? This is normally disulfiram reaction. Disulfiram is a drug which is beneficial in psychologically dependent patient. Okay. So those patients who are interested to quit alcohol, we are helping them by giving disulfiram drug. So when disulfiram drug is administered, it will inhibit aldehyde dehydrogenase enzyme. Thereby it will causes accumulation of acetaldehyde. It is an intermediate metabolite. Thereby it will causes some symptoms like flushing, headache, vomiting, visual disturbances, mental confusion. Based on the development of these symptoms, patient will develop aversion against consumption of alcohol. Okay. So this is beneficial in psychological dependent patient, contraindicated in physical dependent patients. Okay. Similarly, like disulfiram, there are some certain drugs, other drugs also will cause similar like disulfiram reaction. That is also an important MCQ. So those drugs which are causing disulfiram, similar like disulfiram, there it will inhibit aldehyde dehydrogenase and develop symptoms like flushing, headache, vomiting, visual disturbances. Similar symptoms will be formed. Okay. So what are those drugs? Those drugs will be chlorpropamide, cefepozone, cefamandole, cefotitan, griseofulvin, metronidazole, moxalactin, procarbazine. In this chlorpropamide this is an anti-hyperglycemic oral drug. These three, cefepozone, cefamandole, cefotitan, these are cephalosporin drugs. Griseofulvin is an anti-fungal drug. Metronidazole is anti-helminthic. Moxalactin antibiotic. Procarbazine is a chemotherapeutic anti-cancer drug. Okay. Here the main MCQ will be two. One is disulfiram drug will inhibit which enzyme? Aldehyde dehydrogenase enzyme. Okay. Next, drugs which are causing disulfiram reaction. These are the drugs: chlorpropamide, cefepozone. This list will be we have to remember. Okay. Next alcohol is methyl alcohol. Okay. So methyl alcohol metabolism is normally when person consume methyl alcohol, it is converted into a formaldehyde with the help of alcohol dehydrogenase enzyme. This formaldehyde further converted into toxic metabolite, that is formic acid, with the help of aldehyde dehydrogenase enzyme. Mainly here this formic acid will causes toxic symptoms like retinal damage, blindness, metabolic acidosis and death of the patient. Okay. So this is very toxic metabolite. So we have to inhibit by treating them by using fomepizole drug and ethanol and folic acid supplementation. How this will act? Fomepizole will act on this alcohol dehydrogenase enzyme, thereby inhibiting conversion of methanol to formic acid. Similarly, ethanol also inhibit this alcohol dehydrogenase, thereby it will inhibit conversion of methanol to formic acid. But folic acid supplements will helpful by conversion of formic acid into carbon dioxide. Okay, it will break formic acid. Okay, so thereby it will thereby inhibiting the symptoms like retinal damage, blindness, metabolic acidosis, and death. Okay, so here the main drug of choice for methanol poisoning is fomepizole. If you here the main MCQ will be two. One is methyl alcohol causes what are the toxicity symptoms? Retinal damage, blindness, metabolic acidosis, and death. One MCQ. Second MCQ will fomepizole will act on which enzyme? It is acting on alcohol dehydrogenase enzyme. If you see previous one, disulfiram acting on aldehyde dehydrogenase. Okay, these enzymes will be very important. You need to remember disulfiram will act on aldehyde dehydrogenase. Fomepizole will act on alcohol dehydrogenase. Okay, and one more thing is toxicity symptoms of methyl alcohol. It will be very toxic. Optic neuro. These optic symptoms will be there. Retinal damage, blindness. Okay, these are the main symptoms. Okay, that's all. Thank you.